The Lincolnshire vaccination programme has 4 established layers. First layer is the hospital services set up to deliver for our health and social care staff. A second layer was delivered locally by GPs for local communities. A roving service was established to ensure that those who couldn't reach services and those most vulnerable were met. And the fourth layer was the mass vaccination services established in Boston and Lincoln.
Hello, my name's Mark Shaw and I'm the manager at the Sidings Medical Practice here in Boston. In December of last year, ourselves and 2 other Boston practices signed up to an enhanced service to deliver COVID vaccinations to all Boston patients that were eligible. We are working as 3 practices together from the Sidings Medical Facility, and we are delivering vaccines for patients from all 6 Boston practices. We are supported by a fantastic team of volunteers without whom we couldn't run this vaccine campaign. The volunteers are currently directing traffic for us, observing patients for us, meeting and greeting patients in the hub for us. We have a dedicated team from the 3 practices providing vaccines, which is nurses, healthcare assistants. We have a GP as part of that campaign, and they are supported by administrative staff.
I'm Sean, I'm a volunteer. I decided that I'd like to become a volunteer because I felt it was a worthwhile cause. I was approached by the surgery back in January, and it's been quite bleak on days, you know, when it's been raining and snowing and everything, but even so, it's still very much worthwhile.
So partners came together. This was a truly partnership approach across health, social care, local authority and our LRF at the time actually. So true partnership approach in the logistical setup, the staffing setup, the governance setup, all of those components coming together, and clearly LCHS were around the table right from the beginning. So it truly was a monumental effort across Lincolnshire with all of our partners to get these vaccination centres off the ground.
Well, I came out of retirement to be involved. I'm thoroughly committed to the vaccination programme to help people to understand that this is the way to break the virus. So I wanted to be involved from the beginning, which I joined with Age UK, and I'll be here till the end, hopefully, if they still want me here.
The positivity has been great. You know, there's great positivity of people coming, and even all the way through the age band. So the people, the elderly people, were sort of delighted to be out and about, and they would dress up to come, and they really enjoyed coming, and they were very appreciative. And then the younger people are, you know, they're really happy and keen for it too.
But I have to say, everybody that I've encountered, organisationally, personally, professionally, have been amazing.
The experience for LCHS as lead provider, working with the CCG over the past months delivering the mass vaccine services, has been a very valuable process and experience of learning, I think, for both parties and for the people of Lincolnshire. I think on reflection it sets us in good stead as we move into an integrated care system, an ICS in Lincolnshire. It has provided us, both organisations, with the opportunity to develop and grow those relationships and trust, working together differently on behalf of the people of Lincolnshire and at pace. So it has been very valuable for us all.
I think what I would say is thank you. So thank you to LCHS as an organisation for working with us. We asked a lot of the organisation, as we did many of the other organisations, and everybody got behind the system team. They played their part of the jigsaw of the system, and I can't thank anybody enough from the bottom of my heart. Thank you.